All-Star clients, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while we are having some fun along the way. Woo. Okay. Is it me still?
I think so, because he has your name listed first.
Yeah, we're not really good at going with the flow. So,
yeah, we're not allowed to do that.
On today's episode, we have myself, co-host.
I should have read that, because that would have been really funny.
That is you. Wait, myself, co-host, never mind, an associate veterinarian, Dr. Ashlyn Duckwall. The second woman of many hats, Samantha Cercio. The dandy-fine, daringly bold room assistant, Denise Luttrell. And, of course, my lovely co-host, Dr. Emily King. Woo! Okay, that was a lot for me.
So, how are you guys doing?
Good.
After a day of work? Good.
Tired.
Tired?
I just did 2 weeks worth of rebates, so.
Ooh.
Oh, your eyes like ready to... For anyone who doesn't know, Sam does rebates here at the clinic, and that's one of her many jobs, and she is the one who files the rebates for you, so you do not have to do it yourself. You
Which
do,
is so
however,
nice.
have to remember to
Confirm your email.
Confirm your email. Otherwise, the rebate gets lost in some
And
place.
then I have to text you.
Yes.
Story of Sam's life.
Since we're on rebates, also, are they still not supposed to change their password?
Yes. And if you do change your password, just let me know what it is.
Yeah, because then we can't help you when you do not confirm the email or...
Correct. But I did
help.
just find out today, because I never look on the back of my rebate card, there is a card that you can call, or a number on the back of the card that you can call to find out how much is on your card.
Oh.
These rebates are pretty substantial, too.
Yeah.
I mean, it's a lot of money.
Which is so nice, because I had a rebate coupon for like my contacts or something, and I was too lazy and forgot to do it, and I lost out on a good amount of rebate money. And it's really nice that we do it for them. Like,
yes, it is.
I never really understood how big of a deal that was until I had a rebate coupon, and I didn't.
And then you didn't
know
do
what to do. And then I didn't do it.
So when we started that, I always thought of, like, if I was the person, like you were the person with the rebate, then I would want it filed for me.
Mm-hmm.
Well, you can, I mean, then it's not work that you're asking the owner to do.
Yeah.
Right.
You
Right.
know?
And
So-
missing out on that money to go back into your pocket for other things. Because that's another misconception, is that everybody thinks you can only use it for those Zoas products. And I said you can literally use it for anything in the clinic.
Yeah.
So
It's nice.
you can use it towards a dental. You can use it towards treats. You can literally use it for anything here.
Yeah. So it's pretty
nice.
awesome. Yeah. It's pretty
Good
cool.
setup.
Denise, your day was good?
It was swell.
Busy?
A little bit.
I bet, though, Schmoke was in surgery most of the day. So you were doing a lot of the backside of work. Yeah, all the
Lab
callbacks.
callbacks and
It's a lot of work.
Checking in.
messages.
Messages, checking in with clients.
Yep.
Yeah, keeping it all together.
Teamwork makes the dream work.
Word.
Word.
Yes, we should have your sayings up around here somewhere. Start putting them on the walls.
Sharpie on the walls. Harrison would love that.
Yeah, he would. He would. He'd find that really good. To start the podcast, you guys have been here. Both have been here before, right?
Once.
Not on this podcast,
Not on
but
this
on
one.
a
different
one.
podcast. Okay. So
Welcome. We should have confetti.
I know. Yeah. We should have something like in the ceiling that
Yeah. And that kind of surprise them. You watch the Ellen show where they pop out of a box and scare all the.
That's
oh yeah,
amazing.
that would be
I love
hilarious.
that. Please don't do that to me.
I would hate it if it were me,
Crazy.
but
Oh my gosh.
That reminds me. Has Courtney ever told you we pranked her? We used one of the iPads. I hid in the freezer, and Shelby had asked her to help her get a dog in the freezer. And then I
yes, because then they did it to me, and it was terrifying. And they were laughing so hard they didn't get a good video. So then Faust and
we
I
put ours
tried to
in the
get them back
on the
with
water
a
heater.
fake big spider, and we put a clear
no.
string on the big spider and attached it to my my leg. And it was perfect because Schmoke called and asked us actually for like just a second opinion on this cat. And so we both go back there like, this is perfect. We spent like 5 minutes putting the spider on me. and it was so poorly executed. All of a sudden, she's got a cat there. I dropped the spider, and all of a sudden, I go, "Oh my gosh!" And then Schmoke got the most scared because all the techs were on the other side of me, so they didn't see it.
Oh, shoot.
We should totally have
It
like
was not a good situation.
like real life in the veterinary clinic.
I think that'd be very fun.
There would be so much entertainment
Oh yeah.
Oh yeah. I've just told my
if
mom
the
other
cameras
day,
were
we need our
rolling like
own
24/7.
reality TV show.
They have those shows on Animal Planet. They have some. They follow veterinarians and
Yep.
on the farm or in the hospital.
Yeah, if one more person asked me if I watched Dr. Pole,
Oh no, I'm not talking about that one.
I know. But I'm like everywhere I go.
Yeah.
They'll no.
No.
I don't. No, I don't.
Many things not correct in that situation.
Yes.
But
But hey, it might be
we're not
entertaining.
producers.
It might be entertaining. What do we know? What do we know? I would love to have the I think we need to have a day in the life of which cat rides on the
I think they both
Randy.
do, but yeah.
That'd
Randy
be
is
so cute.
I mean, like, he is hilarious when he jumps on that thing.
Is
I've never seen that ever. I am just enamored with that. I cannot believe that because cats hate moving objects.
Yeah.
So like they don't like to be in moving cars. They don't like to be in, you know what I mean?
Yeah.
And he gets on that thing and is like perfectly fine just going around the clinic.
Yeah.
It's the weirdest thing. Does anybody else think this thing is weird? This is so bizarre.
I think Randy's kind of weird.
You know,
special.
He is special, but
That
like
explains
it's like seeing a cat open mouth breathe. Like that is not normal. Like this is not normal. Like we have an abnormal cat, which is really cool.
Yeah.
Like,
Wait, didn't we have another idea we were going to tell Harrison? We just sat down and said,
yeah, we did.
What was that?
What was it?
Oh.
I don't remember.
It was really good too.
I don't remember.
We didn't write it down anywhere.
But I think Randy should be like, I don't know. He needs a purpose here on his cart.
Yeah. I know. It was the walkie-talkies. It just came to me.
Yeah. Okay. Yes.
Yeah.
Okay.
Anyway, moving on.
Okay. So moving on. Icebreakers. What is the best thing you have bought so far this year, Sam?
Wow.
Looks like your shoes.
I got those last year.
Oh.
It's a birthday present for Abby, actually.
Oh.
Should we not say it out loud?
No, she has it already.
Oh, okay.
She said she sleeps with it every day. So backstory before I say what it is. She has been on this kick since like last fall because she said she thought she saw a beaver out here
my God,
in
that
the
beaver.
creek.
I remember she showed me and I believed her
And
because I thought it looked like a
swears
beaver.
It was a beaver.
I believed her.
So I bought
a
her
beaver?
a stuffed animal beaver for her birthday.
Oh.
She said
Awesome.
she named him Justin Beaver.
Oh God.
Jeez. Yeah.
Oh, I can totally see that.
Yep.
And a fart birthday card.
Oh,
It was fart
geez.
related. It was just the perfect combo for her.
Yep.
Beavers and
That's
farts.
perfectly. That does
That's
absolutely
Abby.
wraps it all up.
It does.
And a Dremel to use at home. I bought one of like our battery powered
Oh.
Dremels here.
The battery
The
powered or
dogs.
the plug-in one? The battery
No,
powered.
the battery powered. The plug-in ones scare me. I still
They're
have
fast.
PTSD because somebody kicked me when they were in the sling and it got my finger nail and it went all the way to the skin.
Yeah.
And it hurt like
Yeah, they're fast.
backwards.
Yeah, bad.
Oh,
Mhm.
that's rough.
Yeah, it was bad.
Duckwall, what about you?
Well, I asked Harrison before this started. I was like, was it within the last year of like March 2021 to 2022? Or is it from January 2022 to March, April 2022? So in the first scenario, my horse, obviously, that's the best thing I've bought ever in my life.
Yes.
And number two would be all my extra holes in my ears. I got more ear piercings. I got 3 more a couple weeks ago.
There you
I went
go.
with Courtney.
You went with Courtney and went and got
She
it.
got 2. I got 3.
Oh my
It
gosh.
was great. Memories.
It was great.
I was buying the memory, not the pain.
There you go. I like that.
Yep.
Another saying on the wall.
Perfect.
Denise.
I haven't bought a whole lot, but I'm thinking right now some brisket. A couple months ago.
That's awesome.
Serious.
That sounds
Shout out
really
to
good.
Ben's Country Barbecue.
Oh,
in
did you try?
Westfield.
I have not tried that yet.
Tried it, dude. I've had it for like years now.
Oh, that
Where's
sounds
it at? In
amazing. It's the
Westfield?
one. It's that little
it's
white.
right over
it's
there.
the
The right train.
Yes.
Oh my god. amazing.
I feel like they're always out. Do you have to be there at a certain
or they're
time?
not
because it's
open.
only Wednesday, Thursday, or Friday, Saturday, and Sunday.
Oh, that explains
And
it.
it's from noon till they're out, and they run out really fast. So you have
Wow.
to pre-order
Wow.
on the website
Wow.
or get there right at noon. It's
Jeez.
the best brisket ever.
So it's not like a restaurant. You just order the
No.
meat and got it. Okay.
No,
That's fascinating.
he is the nicest guy and has the best brisket ever.
Okay.
Wow.
And I've had Texas brisket.
And Ben's, it's called Ben's Barbecue.
Ben's Country Barbecue.
Okay.
Ben, if you're listening,
Ben.
Ben,
Hook us
promoting
up.
You're the
listen,
man.
we'll bring you on the podcast if you bring
Yes.
your brisket. Bring your brisket.
Bring the brisket.
Bring the brisket, baby, Ben.
Brisket.
Bring the
Yes.
brisket.
He's probably saying, "Stop mentioning me."
I know, right? Yeah.
But
He probably
no,
doesn't watch it. It's fine.
He's a super nice
We'll send
guy.
it to him.
We're gonna
and be
send it to him.
Anonymously.
Yeah, we are. We're
I
gonna be
will
like,
totally tag him. He'll love it. He's great.
okay,
Oh,
totally
perfect.
tag
Okay.
him. This
And-
is awesome.
His building's cute. It's like a
I
cute
know it
little-
is.
Yeah.
It does. It looks very country.
Yeah.
Yeah,
Love it.
it's awesome.
And he has the picnic tables and
Yeah.
Yes.
good use of that because that thing has been like a used car lot. For,
Yeah.
As long as I can remember.
Yeah.
yes. So
Yeah. He used to just work out of a trailer, like a pull
Oh.
behind trailer thing with his smoker in there, and
Wow.
yeah, best.
okay, we're
Wow,
gonna get
now
we're
I'm
gonna get us some
starving.
Ben's brisket.
Okay.
I can't say it.
Brisket.
Can't say it's too many B's in one
Brisket.
sentence. Brisket. Ben's brisket.
Mhm.
Bring it
Oh, awesome.
With barbecue
with
sauce.
barbecue sauce.
Barbecue sauce.
That's like a lot of bees.
It is.
It's a lot of bees. Your turn.
I
Oh, come on. You could do either one. The last year or the last year.
thing that I have bought. The best thing I've bought.
Anything orange. related.
Richie would tell me. He tells me I spend too much money, so I'm sure he could have a whole list of things that I bought.
Yeah. Nothing like, I don't even know. Hobbies, adventures,
Shoes,
shoes.
brisket.
I am just drawing a blank. Harrison, have I talked about anything? Okay, yeah. I wasn't thinking like that kind of thing.
For all those in here, Harris
Yes.
said a new boat.
Yes,
That's a
yes, I
big
did.
deal.
And I'm going to give you guys one guess of what color the boat is.
Orange.
Yeah, mine is orange.
Nice.
Is it
It's
a speedboat? A pontoon?
Orange and gray, and white, and I think that's pretty much the colors on it.
So many questions. Did it come
you get
orange?
to design it yourself, and so I put it all like orange, white, orange.
Did you get a speedboat or a pontoon?
No, it's a speedboat.
Makes sense.
It's a because
Because
all the kids want to do wakeboarding, wake surfing,
All the things.
all those things, and you can do all of it in this boat. And it is a
Yep.
nautique.
I don't know
Yeah,
what
it's a
that means.
nautique.
That sounds cool.
I don't know
Fancy.
what that means.
Yeah, you guys can come use
Can't
it.
wait to come down and see it for our adventure at your lake house. That
You
has
need
not
to
happened.
come down. Absolutely. On the orange boat.
That's pretty cool.
Yeah. So
Yeah.
So you just go back to the episode, the Five Boys in a Business when Richie was talking about Calvin bought some like robot thing.
yes.
Doesn't he still get random stuff?
No, he's really good now.
Oh, that's good.
Yeah.
That's good.
Harrison disagrees.
Okay, we're getting behind.
'kay,
What's
sorry.
the worst job you've ever had? Denise. Oh, she was getting ready for that.
Golly. It's kind of it's a toss up.
Oh.
I don't know. When I was in my early 20s, probably, there was a time when I was stuffing goodie bags for Chuck E. Cheese.
Nice.
Oh God, that sounds horrible.
It's horrible. It was in this tiny warehouse early in the morning. These ladies, and it was just not fun.
Yeah.
It was,
Oh.
yeah, it was interesting.
Yeah.
It was, I don't know. It didn't last very long. Because when they were done, it was like a certain, quota. And then when they were done, they were like, okay, that was
We're
it.
done.
Oh, go on, bye.
Move on.
Yeah, that was it. But,
Well,
I don't know.
Okay.
It was that, and then for a little while, I was a dispatcher at a teeny tiny local cable company. And that was just horrible.
oh, people can get mean on those
Yeah.
things, can't they?
They don't have their cable. They get
Yeah.
crabby.
Well,
They
this was
threaten to
like-
leave, then you give them a discount.
This
and-
was late 90s.
Mm.
there was no like, email. Nothing was digitized. We had to call people.
Yeah.
And we had to call as early as 7 a.m. and as late as like 4 even on Saturdays. And I'd have to wake people up. Hey, how was your service when the guy came out yesterday?
Oh.
You don't want to wake up to that.
Right. Nobody wants
I
to
don't wanna
wake up.
to that.
It was good until you called me.
Right.
Now it's bad. I'm giving.
Yeah.
Oh, gosh.
It
Bless you.
terrible.
That's-
So,
yeah.
yeah, that was,
Okay.
those were my
So
not,
interesting.
not great jobs. Yeah.
So those ladies were not the type of go to brunch people.
Go to
I mean,
brunch.
Do you want to go to brunch with some people?
well, okay, so one of them was my ex-husband's stepmom.
Oh.
So that's how we got the job. So it was,
Yeah.
it
So
was us
no.
and it was her and the
So
back
no.
friends, and it was
Brunch is a no.
We got there at like 6 a.m, and when we were done, we hightailed it home.
You're like, out.
Okay, we're done. Thanks.
Okay.
So
Bummer. I hope you think you can go to brunch with us.
yeah,
Okay, good.
Sam,
you would
what
have said
about
no.
you?
I would feel really uncomfortable.
I can't really say. I mean, a majority
it's
of
okay.
my I know, right. A majority of I always say this is my first job with a paycheck. So I've done like babysitting or
That's not allowed to be your worst job.
I know. No, I wasn't gonna. No, and then Dudley calls it my sabbatical when I left for a couple months. But even that wasn't bad. Like it was a learning experience. I learned a lot personally. I learned a lot about real estate, and I learned that real estate and veterinary medicine are nothing alike. It was too quiet. I missed the chaos, and I had to come back.
So good learning, though. Good growth.
Yes, very
Okay,
much so.
that's good.
What about you,
Positive
Doug Wall?
things. Well, I've done 2 things in my life: teach tennis or be a vet, so or work at a vet clinic. So between those 2, teaching tennis to small children is not fun. So I literally praise those who teach little kids anything. I mean, school, babysitting, daycare. Oh,
It's all hard.
I
So-
couldn't do it.
it's not fun.
Yeah.
It was a long 30 minutes.
30 minutes.
It was 30 minutes.
And I showed up 10 minutes late.
And one summer I had a broken ankle. So I was teaching these kids on crutches
Oh,
with a
my
boot.
God.
And so I just like basically was babysitting to make sure they didn't whack each other in the head with rackets. And then I was ordering my high school helpers around saying, go do this, go throw the ball here. And that was it. It
I
was
get it.
never again. No.
Yeah.
What about you?
My worst job was probably when I did, does an externship count?
Sure. Why not?
When I did my externship at SeaWorld and I was scooping penguin shit. And it was so boring. And I was like, this is so
That's all they let
boring.
you do?
Why am I here?
Were you in vet school then?
Yes.
They won't let you do anything else?
When I was a 4th year veterinary student and I did my externship because I wasn't going to do small animal, which everyone knows that story.
Yep.
And so I was at SeaWorld in February after getting married in December for a month. Or I was supposed to be there 6 weeks, I think. And I was like, and I'm out.
Yeah.
And so 4 weeks, like part of they had you rotate through different things, but it was no medicine practically. And so I spent one of the weeks was in the penguin exhibit. And yeah, I picked up penguin poop.
Yeah, that's not.
I was like,
Ideal.
yeah.
How do you pick
Sounds
that
like
up?
4th year, but
Is
not
it
ideal.
frozen? Do you scoop it?
It was, I don't remember. I think I just scooped it. I think you just went in the exhibit and you just scooped it.
Yeah.
It was like no big
Did
deal.
you cuddle a penguin?
No.
Did you hold a penguin?
No.
Did you
like
feed
the
a penguin?
I liked the penguins, but I don't think they were in the exhibit. I think they took them out of the,
Oh.
like they let them out, like they have, you know
so
what I
you
mean?
can clean.
And then you clean and then they come back in the exhibit.
Wow.
Well, that's
Yeah.
not even.
No, it wasn't fun. It was not fun at all.
Oh, I'm
And
sure
so
they
then I made up a
appreciated it.
story. Maybe. I have no idea.
The penguins, not the people.
The penguins probably appreciate it. And then I made up a story at week 4 that I needed to go on this other externship where they go to the prisons with, which actually happened, but I wasn't part of the trip. So I could leave SeaWorld because I was like, this is a waste of my time.
So if SeaWorld was ever wondering what happened, no.
Yes. I was like, I wrote my paper, which was required,
Yep.
and then I was out.
Peace out, Girl Scout.
And then I came back and said, I am not doing that job for a living. Can someone teach me something about small animals?
At least you know.
And I worked for a lady for like 8 weeks. And said I could do that job. And so
Nice.
then I got hired by my guy in South Bend, Don Kreider.
And here,
Battery.
that's a party foul.
Yep. So there we go. That was
Okay.
my.
And
Worst
here we
job.
are. Here we all are.
We all made it.
Thanks to the penguins.
Thanks to the penguins. And we all learned so much about ourselves in those jobs. They're hard, but
Yeah.
they do teach you a lot.
Yep.
Yes.
It's the moral of the story.
I started scooping poop and feeding dogs back here.
Yep.
Lots
For
of poop.
sure. For
Lots
sure.
of poop in this world. Okay, case collections. Who wants to go first? Sam, you go.
I was thinking of my dog cousin Tucker with all of his
Oh,
Oh,
gosh.
please
Whatever's-
elaborate.
going on
Rottweiler.
with his butt. I don't really know what's going on.
His
with
butt.
It's your dog cousin?
Mhm.
I didn't know
It's his
that.
aunt. Yeah. It's his
Oh.
aunt. It's her aunt.
Okay.
Okay, never mind.
Yeah. I got you.
He's
Okay.
my
I got
dog cousin.
Yeah.
Okay.
Yeah.
I've heard through the grapevine that there's not some good things going on back there. Well, not good things, but trouble back there.
Yes, there's
right?
trouble back there.
There's trouble.
Yes.
I haven't gotten an update this week.
What did I didn't talk to her on Sunday. We went to lunch and I forgot to ask. But when I texted her, because I think he started pred,
Mm-hmm.
but I haven't asked her about how that's going since she started the pred.
So Sam's cousin dog is an 8-year-old Rottweiler or something like that. Male neutered Rottweiler that had trouble defecating. Originally had loose stool. Dr. Pulse fixed that, but then he has trouble defecating. And we think it's related to his anus and his inability, or there might be tissue there that's abnormal, that's thickened, that's keeping him from being able to defecate normally. So he tries to defecate, but he can't squeeze it out, the smaller opening, or it's stretching. When it stretches that tissue, it hurts really bad. So then he doesn't want to defecate.
Yeah.
Oh.
I think
So
that's pretty much sums it up.
Yeah.
Right, Sam?
Didn't you find it on X-ray, or how did you?
No, it was kind of like a process of elimination because I had the privilege of seeing what other people had done and then what didn't work.
Yeah.
And so then I was like, okay. And then I did a rectal on him, and then he was really painful, and then
I
you could
gotcha.
feel the tissue, and then, so we just kind of like worked our way stepwise through it.
Interesting.
So we ended up treating him empirically with prednisone to see if we could see any type of response.
Okay. Fingers crossed.
yes.
Okay.
So yeah,
Keep us updated.
yeah, he was an interesting case
I was gonna
because it's
say.
such a weird location for him.
Yeah. So interesting. Okay. Denise?
What I can think of recently is that's a heartworm positive case.
Oh yeah, that case is
Mimi?
good. That's a good case. Yeah.
Mimi, she's the sweetest dog ever.
Mm-hmm.
Little Pitty, the owners adopted her, kind of foster adopted, and she came with heartworms. So they've been treating her for a couple months now,
Yeah.
a few months.
Mm-hmm.
I mean, she's doing really well now, and
That's good.
Yay! We just got that test back, and she's negative, and so I think we have to test again another 3 months, 6
Yeah,
months.
7 months from treatment, last
Yeah.
day of treatment.
So yeah,
But she's interesting because she had ascites, right? That's the one that had
Mhm.
ascites. So her abdomen was full of
Yeah.
fluid.
Yeah,
Yeah.
and
Oh,
you guys would be
geez.
sitting there pulling it all out.
oh, forever,
Yeah.
hours. There was just so much.
But the thought is when we treat the heartworm disease that we can fix that problem.
Yeah. Which is cool because at least we have some methods. You can't always fix ascites and what's going on in there. So
yeah.
hopefully it.
And she's a good sport about it.
Oh my gosh, you give her some peanut butter, and she'll just stand there.
Yeah.
Yeah, it's
She's a nice dog.
amazing.
Yeah,
Sweetest
she's so
dog
sweet.
ever. It's I mean, you feel bad for her because
Yeah.
they don't ask to have heartworm disease, and
Right.
they
Right.
don't. I don't know her backstory. I think she was just a stray. I think, and they tested her, and she came up positive, and luckily they were willing to treat it, and
Yeah.
she's one of them that it worked well for. So
Yeah. Moral of the story: keep your dogs on heartworm prevention
yes,
because it can cause fluid in your belly and bad hearts.
it
Bad
can. And the
hearts.
treatment is not fun. She did not feel well a lot of the times right
Yeah.
after the treatment, just because the treatment's not great.
Yeah.
Right.
It's
Hard on
prevention
them.
is so much easier and cheaper, it might seem expensive, but it's a lot easier on the dog and much cheaper in the long run. So
Yep. Yeah. Fascinating.
Yeah.
She's a sweet girl.
She is. I love her.
Absolutely.
Yeah.
My case is, do you want me to go next?
There you go.
I did a referral case ultrasound on a 12-year-old Dalmatian / pit bull mix that they thought had bladder stones. And so we did the ultrasound, and because the type of stones that Dalmatians can get are urate stones, which you can't see on x-ray. And so the referring veterinarian wanted us to ultrasound them to see if she had any stones, because on ultrasound we'd be able to see them because of the sound waves. So we were doing an entire abdominal ultrasound, and the left kidney had hydronephrosis. So I was able to follow the pelvis of the kidney all the way out the ureter, follow the ureter all the way to the bladder where it emptied into the bladder.
Yeah.
And where it empties into the bladder, there's actually a mass. So
What?
yeah, a mass on the bladder wall
Wow.
that then is obstructing the ureter. And so then that's why you have dilation all the way back to the kid. You know what I mean? Because
Ah.
the point of obstruction would be, you know what I mean? It has to be somewhere. The
Can't
whole
empty
ureter's
anywhere.
dilated, right?
Yeah,
The whole
can't
ureter's
empty.
dilated.
Wow.
So, and she
Wow.
does have stones in her bladder as well. And I do think there's a stone in the most distal part of the ureter. But on the bladder, when you look at it, you can actually see the change in the bladder wall. It's
Wow.
like this mountain where the ureter comes in. And then when you scan the ureter and follow it in, you can see this tissue that is abnormal.
That's
Yeah,
fascinating.
it's fascinating.
So what'd they do? Do you know?
They're going to see if they want to, because she would be a referral to
Yeah.
a specialty practice
Yeah.
for some type of either advanced imaging, surgical removal.
Yeah. Because
You
that's
know,
a tricky spot. Like,
Right.
wow.
Could they remove that part of the bladder wall, since that's, kind of a thing?
So interesting.
Yeah. So very cool case.
Very cool. Keep us updated on that too.
I know.
So many things to follow.
Very interesting.
Okay, well, mine is Sid. He's a 6-year-old male neutered terrier mix thing. He kind of looks like Toto. That's what I call him. Yeah, he's cute. He's so sweet. So he had these, when I first saw him last year for his annual, he had these like pigmentary, just kind of freckled dots on his belly. And he's a mostly brown terrier. So his skin is pigmented anyways in some spots. So we just decided to watch him because they weren't raised or whatever. So then she's a great owner, brought him in and was like, it's starting to become raised and kind of bumpy. So there was a spot where it turned into an actual like mass, like almost like a mass, a mole sticking out almost. And then other areas it was just kind of bumpy. So knowing with skin, sometimes you just have to go straight to getting a sample. So that's what we did and send it out to Texas. And it came back as, what did I say? Pigmented viral plaques. And that's lesions associated with the papillomavirus infection. And that's a very common one that it's very contagious, transmissible from dog to dog. And what you'll see is basically warts show up on the body. But I'd never seen them pigmented like this because you worry about like melanoma or something scary.
Right.
So send it to our local dermatologist, Dr. Lori Thompson. She's phenomenal. And asked like, okay, is this really true? Basically, she said, yes, it's a perfect example because they sent her pictures. And so treatment, the nice thing is it's treatable, go away. But you have to use like a combination of things
Of
for
medications.
warts.
For warts.
That's all we'll say.
That's all we're going to say.
It's different in humans. Let's put it that way.
That's right. Exactly. And enough said about that. Okay.
Okay. That's it. On to the question.
That's a cool case.
Yeah, it's very interesting. Pictures are cool. That's all I got.
That's all you got.
That's it for me. Okay. We're
Okay.
on next. Okay.
Okay, go ahead.
Client question. Had to put our baby of 12 years to sleep. I'm sorry to hear that. That's sad. She was full of cancer. Are some dogs more prone to this than others? Tammy Hilfiker? Hilfiker.
Thank you for the question.
Yes, thank you for the question. I'm sorry about your doggo. That's sad.
Yeah, that's always sad and difficult.
Yes. I didn't look up the breed. Do you know the breed of her dog?
No, I didn't. I mean, I do, but I don't. I'm trying to remember. Harrison will help us out. So what do you guys think when you heard that question?
There's some that always pop into my head.
Yeah.
Whenever I think of.
I mean, my first thought is golden retrievers. Everybody always says golden retrievers are super prone to cancer. So then that just makes me cry when I think about Wilson because he's only 3 and I don't want to hear about. I don't want to talk about it.
Boxers.
Mm-hmm.
boxers.
Back in the day, boxers were the poster child.
Yep.
Mm-hmm.
I mean, some larger breed dogs like Rotties, or I guess it depends from there. Great Danes, maybe they just have a shorter lifespan, so we can maybe see more development.
So I think,
of
I
things.
mean, you could go through different breeds and know what cancer they seem to be predisposed to.
So there is a link to breeds. Let's
Yes.
put it that way.
So, giant breeds with osteosarcoma,
Mm.
right? And then boxers with mast cell tumors, seems like. German Shepherds with
Anything
anal gland stuff.
Yeah.
Yeah.
Golden Retrievers with lymphoma
or hemangiosarc.
or hemangiosarcoma.
Mm-hmm.
What other ones?
Oh,
can you guys think of?
Scotties for TCC.
Yep.
They're literally the
Yep,
poster child. And
Yep.
that's been like Dr. What's her name up at Purdue?
Moncrief?
No. The oncologist. Knapp? Dr. Knapp?
I don't know.
I don't remember. So that's like what she's dedicated her career to, is research with TCC, but specifically Scotties to the poster child. So there's definitely genetic components. There's environmental components
Yeah.
to that. It's
Mhm.
just,
Wow.
is very intriguing, but they're,
Is that like the bladder?
yeah, sorry, TCC bladder cancer. Yeah.
Because I was thinking miniature schnauzers too.
Yeah. Kind of depends on, I mean, they're definitely in the same kind of realm of terriers and
Yeah.
stuff too. So yeah. So I guess, I mean, to answer the question, there are some cases that are more predisposed just by being the breed that they are. Does that mean they're going to get it? No. But I mean, with dogs' lifespans and what we can see, we have the benefit, privilege of seeing a dog basically from start to finish. And so we just can track that a lot easier too. Right.
Mhm.
And so, I don't know.
I think the dogs live longer too.
Mhm.
That's what I was thinking.
You know what I mean? So like
Mhm.
they have, people are taking good care of them. They have better food. They have better health care.
Yeah.
They live longer. We see more disease than geriatric disease potentially.
Right. Yeah.
So that might be a factor too.
Yeah.
But
I think there's a lot of components to it. I mean, it's not for a 12-year-old dog. Did you look up the breed?
She has a few dogs that have passed away, so I don't know which one. I
Okay.
One that's recent, so I don't know what it could be.
Okay. I mean, 12 years and any dog is still a really good life.
Yeah.
Like,
absolutely.
yeah.
I would think most people think 12 years is like the minimal. And I'm like, that's
Yeah.
really good age though.
Right.
Like, you know what I mean? Like, but as my grandpa would say, like, it's never enough time. It doesn't matter how much time you have. It's never enough time.
Yeah.
So like, but I'd say 12 is a pretty good age.
Yeah.
Now, if you're, a Maltese, okay, well then maybe it's closer
Right.
to 14.
Right.
Right.
You know,
Yeah.
they're old men. They have a
Yeah.
tendency to be old and they look old when they get that old. But
Yeah.
what's the oldest dog you guys have ever seen?
Recently is Buttersmith.
Oh god.
Oh yeah.
I think she's
She's almost
18
18.
or almost 18
Mhm.
now.
Wow. Yeah.
Yeah.
But before that was a boarding dog. She was a pointer, German short-haired pointer that used to board all the time. Was blind, deaf. I think she was like 19.
Wow.
That was a long time ago. That was
That's
back
a-
in the kennel days.
I mean, that's still good for a pointer too.
yeah.
Yeah, I feel like they like to live forever. I do.
Hey,
I do.
Winnie.
Yeah, I know. I feel like they do. I think for large breed dogs, I feel like they're some of the longest living dogs.
Mhm.
I see them like 15.
That's so fascinating.
Yeah.
It's because they're so stubborn. They just don't give
Oh,
up.
yeah.
You
One of the
know?
first clinics I worked at, I saw, oh God, what was it? I think it was an Italian Greyhound. He was 21, 22.
Wow.
What?
Yeah.
Wow.
Wow.
He was something.
Wow.
He was
That's impressive.
blind. He was deaf. He kind of sat like this.
Yeah.
He couldn't sit straight.
Yeah.
Dad fed him whatever he wanted. Refused to feed him dog food.
Yeah.
He ate steak. He ate whatever he wanted. And I mean, he had like 2 teeth. So,
Oh my gosh.
Yeah.
I mean,
You don't have many
that's,
teeth at that point.
No. And he was the sweetest thing,
Yeah.
But yeah, that was the oldest dog I've
Wow.
ever seen.
Yeah. I don't think mine beats those. Mine definitely doesn't so far.
What's your oldest one?
I don't know. Like 16 maybe? 17. Cats, I've seen a couple 18, 19-year-olds. But dog-wise.
Yeah. I've seen it. Yeah, the cats can be they can be really
20,
old.
21.
I've seen 24.
Wow.
24?
Again, not in great shape.
Right.
You know, blind,
Yeah.
deaf, no teeth
Right.
at all.
Right.
Evil.
Oh,
You know, I
always
love
the evil
cats.
ones.
You know, I
It's
love
always-
cats, but
yeah.
she was evil,
Yeah.
and I loved her. You know, of course I did.
So much
but yeah,
fighting
she
them.
was up there.
Yeah. Interesting.
Wow.
Mm-hmm.
So yeah, I think there's environmental factors, genetic factors.
Yep. So are some dogs more prone? Yes. I
Yeah.
guess the answer is yes, but
I think
not a
some of that comes
guarantee.
like if you're getting right, and I mean mixed breed dogs, you would think they have a wider genetic diversity, so potentially can maybe avoid some of those predispositions.
Mhm.
But
until you
know-
get into the golden doodles, which are mixed, or the doodles in general.
Mm-hmm.
yep,
They're not so mixed anymore.
exactly.
Yeah.
So I think some of it can be the breeders, the reputable breeders do try and breed out
Mm-hmm.
some of those diseases that the breeds are known for. But I mean, it's not perfect science,
Right. Right.
It's not, yeah. So unfortunately, we see cancer a lot,
Yep.
Mm-hmm.
a lot.
Yeah, that's a tough one. I mean, there are oncologists out there. There are chemotherapy, radiation treatments, things like that. But sometimes it does come down to the quality of life for the pet too, because we have that ability to decide that for them and not make them suffer in specific ways. But fun fact, chemotherapy, animals tolerate it a lot better than people. I
Yes,
think
they
that's
do.
something to remember, that there really aren't major side effects that we'll see in animals. It's actually very minimal, and so it's GI stuff. So I think a lot of times I talk to an owner about potential treatments if they're interested, and that's a big concern. Is like, oh, I don't want to do that. Well, just remember it's a little different. And in
cancer,
dogs.
and cancer therapy's come a long way in
Mhm.
dogs. I mean, I think from radiation therapy to I mean, there's just so many different chemotherapy to. I mean, there's a lot of things
Yeah.
out there nowadays.
Yep.
That people can take advantage of.
Oh, yeah.
So-
For sure. I don't think I knew that, though. That dogs, I mean, it would make sense because, like, they metabolize medications differently than we do. So that would make sense.
Yeah.
Yeah, they tolerate it really well.
Yep.
Their hair doesn't fall out.
Something
Nope. It does not.
new. Oh, yeah. I guess I never thought about that either.
Mm-hmm.
Well, and there's certain chemotherapies make your hair fall out, and not everyone does. But,
Right,
I mean,
right.
Yeah.
Huh.
Yeah. So that's a common question people
Yeah.
ask.
Yeah. Anyway.
But Tammy, we're sorry for your loss.
Yes.
Yes.
It's
Thank you
never
for the
easy, no matter what the
question.
cause is
Yeah.
or how old they are.
or how old they are.
Mhm.
Yeah.
Absolutely. So
Well, if you have any questions about cancer, call us.
yeah,
We can help.
absolutely.
Okay, you're the outro. I did the intro.
Okay. All right. Yeah, we're always happy to help. So navigate those conversations and help diagnose those pets. So, all right, everybody. Thank you so much for turning into. It says turning into right there. And I was like, that doesn't sound right. Thank you so much for turning into
tuning.
another episode of the Veterinary Roundtable. Tuning into. Turning. I don't have my glasses. What can I say? Oh, Veterinary Roundtable. Remember, send in those questions and be sure to follow us on social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable. Thank you, Sam. Thank you, Denise, for being here. Thank you, co-host.
Always.
Always. All right. We'll see you guys on the next episode.
Bye.